and I want to welcome you to the last hurrah, our final webinar in a series we are calling under our community of practice for the freshwater conservation and water and sanitation and hygiene task. We have had about, I think maybe now 7 or 8 of these webinars. They've been really, really enlightening and been very important for us to share with our African colleagues and our colleagues in DC and around the US some really important lessons on integrating these 2 important topics together in different parts of Africa. So we're really, really pleased to have Pathfinder International and the Nature Conservancy today. Just a word about ABCG. So the Africa Biodiversity Collaborative Group is funded by the U.S. Agency for International Development's Africa Bureau. And we've been going strong for many years now. We're at the end of our current grant in September, and we're going to have another 2-year extension. So we're really pleased about that. And hopefully we're going to continue to highlight all these great thematic issues that are so important for biodiversity in Africa. And the Freshwater Conservation and WASH Task has been piloting some innovative emerging guidelines on how to bring these 2 sectors together. And this is a really great opportunity for us to showcase the work in Tanzania. So I'm going to turn it over to our colleagues. We have Josaphat Mshighati, hopefully I didn't destroy that too much, from Pathfinder International, who has been the Director for Advocacy and Population Health and Environment in Tanzania, and I understand maybe the acting country director at the moment. So we're very pleased we could have you. And then Lukindo Hiza from the Nature Conservancy, who's the Tungani Program Director. So Lukindo, I believe you're going to start us off, giving a little bit of an overview. And then we're going to move to Josaphat. And hopefully, fingers crossed, all the technology works. So Lukindo, over to you.
Thanks a lot. Hi, everyone. My name is Lukindo Hiza, as I've been introduced, the Tungani Program Director. Sustainable natural resource conservation, population, health, water, sanitation, and hygiene are complex issues that need an integrated approach to solve. So in this slide, I'll be speaking and showing you what is the meaning of Tungane. Please, next slide. Tungane is a Swahili word for let's unite. It unites the nature conservers, Pathfinder International, district governments, and local communities into integrated project that simultaneously address complex issues of population, health, and environment, abbreviated as PHE. The project empowers community to create healthier families, forests, and fisheries in the greater Mahale ecosystem, which is located in Western Tanzania. In the next slide, I will speak the project goal. Next slide, please. Our project goal is to conserve the greater Mahale ecosystem as a diverse, functioning ecosystem, sustaining health and resilient human and natural communities. The greater Mahale ecosystem, or GMD as we call it, is located in Western Tanzania on the shores of Lake Tanganyika. The map you see now in this slide shows a portion of the greater Mahale ecosystem and the project area, which covers a total of 4.8 million acres. This is equal to 1.9 million hectares. At the heart of the project area is the Mahale Mountain National Park, as you can see bounded in the green in the slide, in the map in your right-hand side. In the next slide, I will speak the importance of the greater Mahale ecosystem and why are we speaking the greater Mahale ecosystem. So this is the initial what that makes greater Mahale ecosystem so important, also special. As you can see in the slide, the 4 pictures. The first one, it is because greater Mahale ecosystem is the one among the 34 biodiversity hotspots in the world, and for that case is a global conservancy priority. Lake Tanganyika is the home to more than 250 endemic fish species, that is substantial high level of endemism. The forest in Greater Mahale ecosystem supports 93% of Tanzania chimpanzees population. In addition, Lake Tanganyika contains 17% of the global freshwater and is an important source of income and protein for the local communities living along its shores. Therefore, the Greater Mahale ecosystem is a critical, important ecosystem in terms of people and nature. With all this importance, in this coming slide, I will speak to the threats that are facing the Greater Mahale ecosystem. Next slide, please. As I have said, with the already aforementioned socio-economic and ecological importance of Greater Mahale ecosystem, there are a number of threats to this area, both to the ecosystem and the well-being of the communities. First, the majority of the area is unprotected, and 75% of the chimpanzees are living outside of the protected area. This is equal to 70% of all Tanzania chimpanzees are outside of the protected area of Greater Mahale ecosystem. Second, there is inadequate access to primary, sexual, and reproductive health services with a rapidly growing population that have very few economic opportunities. Thirdly, communities in this area rely on unsustainable fishing and farming practice that threaten the long-term stability of these two resources and their ability to produce resources for the families that depend on them. Moreover, there is weak local governance, which is further hampered by very low literacy rates. On top of that, impact from climate change exacerbates all the above threats, which the greatest impact on the most vulnerable, the women and the youth. In these slides, I'll be speaking the approaches Tungane use. The Tungane project takes an integrated approach and focus on the 3 F's, that is families, fisheries, and forest. For families, the projects provide access to basic maternal and child health services and to health and family planning services for those who want them. For fisheries, the projects organize local management units to prevent the most destructive type of illegal fishing, such as using mosquito nets, and promote alternatives. For forests, the project helps establish community wood lots for firewood production and helps people farm more sustainably on the edge of the forest. The project's theory of change is that if we take an integrated approach to people, health, and environment, that is to PHE, then we will have greater impact than doing separate health and environment projects. In short, with an integrated PHE approach, a synergetic 1 + 1 + 1 is equal to 4 rather than equal to 3 is realized. In the next slide, you will see a diagrammatic presentation of Tungane's theory of change. Here is the theory of change for the entire Tungane project. Freshwater, fisheries, forest and land use, families, health, and integrated in a converging point we call model household that you will hear more in slides to come. From model household, a divergent impact of healthier family, healthier forest, and healthier fisheries are attained. Next slide, please.
Thank you so much, Lukindo, for giving that overview about Tungane. So this is now Josaphat speaking from Pathfinder office Tinda. And I'm now going to zero down to our discussion today on water, sanitation, and hygiene, WASH, and how Tungane project contributes to WASH as a community. and how we also contribute to that globally. So WASH has been an integral part of the Tuungane work from the beginning, because we see it has huge implications on the human well-being and the health ecosystem which we address. Let me also declare that Tuungane is focusing some aspects on WASH, but we really don't have a huge component on WASH, but we contribute significantly to some areas of WASH at the household level and at the community level. So Lukindo just gave a theory of change for Tuungane as a project at large. In the next few minutes, I'll also give our theory of change specifically for WASH for the Tuungane project. But before I go there, let me just say that we all understand the statistics we are having from the World Health Organization, which show that although access to sanitation has been improving over the past years, it is still estimated that about 2.5 billion people, which is more than actually 1/3 of the global population, they still live without basic sanitation facilities. But considering the importance of WASH globally, we all know it was included in the as part of the Millennium Development Goal. For those who must have read the MDGs, there was a target to halve the proportion of the population without sustainable access to safe drinking water and basic sanitation by 2015. So this ended, and now we are in the SDGs. So target number 6 in the current Sustainable Development Goals talks really about ensuring availability and sustainability of water and sanitation for all. And therefore, as Tuungane project, we are doing some aspects to contribute into WASH. And through our population health and environment approach, which we adapted in our project, we actually see we are contributing to 11 SDG targets, which you see on the screen, out of the 17. So specific now about the WASH under Tuungane, in the next slide, I'll talk about the goals for WASH, both health and environment. So straight on the WASH aspect for the health, we really want to see that we reduce the risk of diarrhea. This has been an issue in our Tuungane villages over the years before we started the project. It has gone down a little bit. We'll hear that when we talk about the survey we conducted in 2016. But we also want to reduce the spread of intestinal worms and other neglected tropical diseases such as trachoma, because all these cause a lot of suffering for the millions of people. And in our project area is also an issue. We also want to reduce severity and impact of malnutrition in the communities we serve under Tuungane. But particular for the women and girls, we wanted to promote the dignity and boost the safety for the women and girls. But we also want to see WASH contribute to the girls' attendance in school, particular looking on the focusing on these having separate sanitary facilities for the girls and boys, but also some kind of having some sanitary facilities for the women, especially to attend them during the menstrual cycle, so that they feel they are part and parcel of the school, they continue the attendance even if they are under their menstrual cycle. In the next slide, I'm going to talk about the WASH goal specifically on the environment. Our key environmental goals for fisheries and forest conservation, which are relevant to WASH, these are to strengthen the fisheries management, and improve governance through the support of the beach management units. The photo you see on the slide, on the right, that is our staff member, our fisheries lead, Mr. Limbu, who is having discussion with the members of the beach management units. That is part of what we do to strengthen the capacity of the beach management units. But we also promote sustainable fisheries by reducing illegal fishing and also by protecting the fish breeding sites, which we support as a project. But we also work to improve the forest management through conservation agriculture training, which we do a lot. But also we focus on reducing sedimentation through tree planting and adopting climate smart agriculture practices. So those are the two goals we have under the Tuungane project, under the WASH, the health and the environmental goals. So I spoke previously that Lukindo took us through the theory of change for the project, but we have one for the specific for the WASH. And in the next slide, I'm going to talk about our theory of change for the WASH. So in our project, this is what we would like to see happen at the end of the day. We believe that if we improve sanitation and hygiene, and we're able to decrease the disease burden from water-related pathogens or water-related diseases, then we're able to increase the time people have for other activities. You see the photo, see the women, actually they're walking some distance going to get water actually from the lake. So we believe if we're able to set some water sources at the household level, at the school level, then we're able to reduce the time these women work from the lake to their homes. And you see a piece of land with maize, then if we save their part of time for fetching water, then that implies we're able to have them spend some time on their farm for economic activities and for improving food security. But we'll also be able to enable the children have better school attendance, but to also improve the overall well-being of the children, the women. So if we're able to do that, then we're able to create a healthier aquatic and terrestrial ecosystem. But we are also then able to contribute some level to mitigate the climate change. Also, we should be able then to promote more sustainable water management practices, safeguard the health of wildlife and that of the people. So that is our theory of change for the WASH. Now, let me narrow down to how we see WASH at the household level. So in the next slide, I'm going to talk a little bit about the model household concept and how that it contributes into the aspect of WASH under the Tuungane. So we currently do most of our WASH activities through the model household. So what you see is what we call a model household. This is what we envision each household in our Tuungane project looking like. So we have the PHE champions, we have the community health workers who work to make to contribute to this. But what you see on the photo, let me just briefly say about this model household. You see on your further right towards the hill, you see a building there. That is the toilet. Outside the toilet, you see a young boy washing hands. We have a tippy tap. There is one of the mechanisms we use for washing our Tuungane villages. So for the wash, then we promote each household to have a toilet. And outside the toilet, they should have a water system and soap where they can clean their hands. So that is part of it. Again, you see the main house. We promote that family members live in the main house, which is separated from the shelter for the animals, which you see on your right. You see some chickens, some duck. We promote that they are separated from the main house. That is also part of health part of it. But you also see a kitchen there and a woman cooking in there. In there, you see also a mechanism to take the smoke out. So that will also save the women who spend time in the kitchen, avoiding some respiratory diseases. But you see the drying racks outside. That's where they dry their food, but also a dry rack for the cooking utensils. So those are part of the model household when we talk about the wash. But further on your east, you see some like a hill with a steep slope, and we see some terraces. That is another mechanism for climate smart agriculture, where we promote the terracing that reduces sedimentation to the lake, which you just see closer there. So that is how we see wash as fundamental for everything that we do in our Tuungane project. And then model household then becomes an integral part of the program. And then we have the PHE champions, the community health workers, who really disseminate the information about population health in the environment, and specifically on WASH. So that is how we contribute at the level of the household, how we contribute to aspects of having a clear environment, aspects of having toilets, but actually having the water system where people can clean their hands when they come out of the toilet. So in the next slide, I'm also going to talk about some environmental consideration. We all know, in the previous slide, I spoke about the model household, and we all know that the wash outcomes are partially determined by the human factors, like what we saw in the pictorial form of the model household. But we also know that they're also determined by the environmental factors, like the hydrology and the ecology, because the watershed then determines also the control of the quality, the flow, and the quality of water. So you see this very nice photo. This is from the Mahale National Park, where we have most of the water streams running from there. So if we're able to protect this area, we're also able to protect the quality of water. Having said so, in the next slide, I'll show you some wash activities which we undertake as Tuungane. So we are having some prevention targets, which are including the improved behavior, such as the use of the tippy tap and soap, just like you see the boys are doing there. They are washing their hands. That's what we call a tippy tap. Then closer there should be soap. But we also promoted the dish drying racks, also the boiling water. Those are very important for the prevention part of the wash. But we do a lot in terms of providing improved information through the outreach. As I mentioned, we have the community health workers, we have the PHE champions, but we also work with the healthcare workers to provide wash education at the community level. All those contribute to disseminating information for the people to understand those efforts and how they contribute to the health of the population and that of the environment. But we also do a lot on improved environment. So the issue of latrine is our key focus, and actually having a latrine is one of the criteria for becoming a model household. But the dishwashing should also be far from the lake. Before we started the project, people were washing their clothes, everything at the lake. So through the sensitization, education, through the PHE champions, community health workers, now they are doing that at least far from the shore. But also through climate smart agriculture, conservation agriculture, we're also promoting farming distant from the shore. So we do a lot with the beach management units also, especially on the environment aspects. And in the next slide, which you see there, We are also having some conservation activities we do as Tuungane, a part of it which is under fisheries, where I mentioned we do a lot with the beach management units, also supporting them to eradicate the illegal fishing gears. But we also use to make sure we improve forest management through conservation agriculture training, also through tree planting, which reduces sedimentation into the lake. So that is what we have been doing since 2011. So in the year 2016, we conducted a sort of a midterm review, where I will now hand over to Lukindo to give us things which came out from the baseline and the follow-up survey which we conducted in 2016.
Oh, thanks, Josaphat, for taking the audience through what we are doing, as well as detail of our WASH-specific theory of change. Now, as Josaphat has said, after doing all this work, we measured ourselves. So we conducted a baseline in 2016, compared to the impact. And in this slide, I'm taking you through the next consecutive 5 ones. I'll be speaking the impact of our work on the ground. So just in short, really, to talk about our impact from the project on water, sanitation, and hygiene, I'll be speaking and taking you through in the next slide on the results we attained on latrines, access to drinking water, results on hand washing, support on sustainable fisheries, improving forest management, and smart climate agriculture information that we gathered during our study in 2011. And we'll be comparing this data with the survey we conducted in 2011. We also, along with this survey, we conducted a focus group discussion and the interviews to gather qualitative data to help us further understand this data and dive deeper into topics of interest. This work was funded by Tuungane Project, the Nature Conservancy, Pathfinder International, and the USA funded Evidence Project. So in this slide now, here I'm speaking on latrines. One of the most important criteria in our model household, as Josaphat has already presented, is the presence and use of latrines. A household's toilet facility, and whether or not it has to be shared with other households, is an important well-being and health indicator. In the Mahali area, there are 2 common types of latrine that are used by more than 90% of the households. The first type, and the most common one, is the open pit or pit latrine. This is a pit latrine without a concrete slab. And the other one is the latrine with a slab. In the year 2011 survey, as you can see in the slide, 33% of households indicated they had an unshared latrine with a concrete slab. But enumerators did not ask to see the facilities. Even though you could expect that it is going to increase, the percent will increase, but in the year 2016 survey, enumerators did ask to see the latrine. The results showed a drop from 33% to 19% of households with unshared facilities. Asking to see the facilities could explain why we find a lower proportion of households with an improved latrine and a higher proportion of households with no facilities, from 2 in 2011 to 5 in 2016. In the next slide, I will be speaking on access to clean water source. Water source were categorized as improved or unimproved, following World Health Organization and UNICEF standards. Improved sources include public taps, protected private and public wells, and rainwater. Unprotected sources include open wells and surface water. Questions were asked for both dry and wet seasons, as water sources can change depending on the season. In the wet season, more villages show difference. In 2016, almost all villages in the north show large increase in improved resources, mainly rainwater. In the south, the picture is mixed. Looking at the whole year, and again only including households from sub-villages that were covered by both surveys, 17% of the 2011's household had access to improved resources in both seasons, while 14% did in 2016, but the difference is not statistically significant. So in the next slide, I'll be speaking on hand wash. The project aims to increase hand washing, specifically by encouraging the use of tip tap. This is a way to rinse hands without touching the water source. The tip tap has been shown by Josaphat in the slide which elaborated model household. A new question in the 2016 survey asked whether household had a prepared place or way for members to wash their hands. Enumerators asked to see this place and noted whether it had water, soap, sand, or ash. Most households, as you can see, 81%, second column just below in the table there, had a place, sometimes just a jar with at least water ready for washing. Only 70% of the interviewed households, as you can see in the table, had no such a place. 49%, which is about half of the household, had either soap, sand, or ash available in the hand washing place. And slightly fewer households and both one of these and water present at the time of the interview. In the next slide, I will speak on sustainable fisheries. In supporting sustainable fisheries, 15 beach management units, abbreviated as BMUs, have secured legal authority to manage freshwater resources, including protecting 3,286 acres of fish breeding sites and deterring use of illegal fishing gears. The map in the slide you see shows 5 of community fish breeding sites that have been demarcated and registered. Also, results of the 2016 follow-up survey showed that 33% of the interviewed, as you can see the graph, fishers perceived an increase in fish catch, a significant increase compared to 5 years ago, that is compared to 2011. And in the next slide, I'll be speaking the impact result to forest management. The next slide for forest management, please. Oh, yes. To improve forest management, improve crop yield, and reduce deforestation and siltation, 904 farmers have been trained on sustainable agricultural practices. Of course, trained. Of course, this trained one. 40% out of them have adopted improved methods. In addition, it's more than 500,000 trees, that is 534,000 trees have been planted, which is expected to reduce erosions that can lead to siltation of freshwater streams and rivers. When asked during the 2016 survey, 68% of respondents agreed that deforestation causes siltation, a figure that increased from 2011, as you can see in the graph in the slide. This matters because in the project area, siltation reduces fish stocks. Though this is a positive change, we saw only a small increase from 30 to 36% in respondents who agreed that siltation from the river is harmful to the fish in the lake. Thus, more education is still needed on this. But at least most people now understand the first link in the chain between deforestation and the fish breeding. Now I'll be handing over to Josaphat to speak on our conclusion, and maybe we'll be going to recommendation.
Thank you so much, Lukindo. So just very briefly, in conclusion, we have some of our key conclusions related to wash and conservation. We see we have contributed to reduced prevalence rate of diarrhea from the figures which were shared in the statistics from the survey. But also we have been able to contribute to the increased perception of fish catch. Now people understand how fish catch is related to siltation. But also there has been an increased understanding that deforestation causes siltation. So those are the things we have at hand to show how we have contributed into the WASH outcomes. However, we still have a situation where just a few people have access to improve the water source. We still need to allow for significant time to gather water. People have to walk to the lake to fetch water. But also it's difficult for people to construct and maintain latrines because of the economic status. They would love to, but then to have a decent latrine is still an issue. But also not all the latrines and hand washing stations here are used. So we still have a challenge which we needed to address further. Now, in the next slide, I'm just going to talk very briefly about the recommendation and the future activities we are aiming to undertake. Simply, we need to emphasize the engagement on the community-based information on WASH. As I mentioned, we have the community health workers, we have the PHE champions, but we also need to work more and more with the community healthcare workers who are stationed in the health facilities in our project area to provide this WASH education during the community meetings. We also need to work more and more empowering the community members, especially on the economic part, on their livelihood, because we have seen that they like to improve the toilets, but they cannot afford a cost like for the toilet slabs. So we need to invest some more activities to enable them gain more on the livelihood opportunities so that they're able to gain some income which they can now use to improve their toilets. As I said, we are not any expert in WASH, and it's not our huge component, so we need to connect with the other organizations which specialize on WASH. But we aim to increase our engagement more and more with the local government on the benefit of improved access to water. We need to team up with the local government to do some proposal and see how the government can allocate some fund, and then we raise some fund as a project to top up so that we are able to work around the access to water at the household level, at the school level. But we are also aiming to continue improving adoption of climate smart agriculture. We still need to work more and more on conducting education and outreach on the linkages between siltation and fish population in Lake Tanganyika. But we also need to work more and more on the environmental education, especially in schools. We have some school clubs where we do some WASH education, but we also need to work more and more to also link how we can have tip-tap in every school, in every household, and how we can also be able to link other areas on the importance of having clean water source in the schools, especially to address the issue of menstrual hygiene for girls, so that we are able to promote retention of girls in schools. But we also need to really put a lot of discussion with the community members, with the village government, and other NGOs around as to how we can improve discussion about the WASH, and how we can attract the other people working together to improve the WASH outcomes in the communities where we are working. And we also need to raise some more funds so that we're able to support the community members with the income generating activities so that they are able to generate some income and be able to afford some of the basics in the area of clean water supply at their household, but also them being able to construct decent latrines, them being able to use to have water, So those are the things which we are aiming at investing in the next few years under the Tuungane project. In the next slide, I'm just saying thank you so much, guys, for listening to me and Lukindo. Those are the few experiences we are bringing from Tuungane. And as I mentioned, it's not our huge area, but those are the key things we have been able to contribute as a project when it comes to WASH outcomes. Thank you so much for listening. You are welcome now for any questions, comments. Asante sana.
Great. Thank you both very much. That was an excellent presentation, and we're always very encouraged to see the model household, which brings together so many of our multi-sectoral basic needs. It's nice to see that model that you have there and to see how well it's working. So I'm going to ask people to type in their questions. I see that we have a couple. I'm just going to ask one before we kind of kick it off. Could you just speak a little bit about your PHE champions? Are those men or women? And how do you see their role expanding in your future recommendations?
We have the people, we call them the PHE champions. These are the individuals who volunteer to be working with the project to provide the population health and environment education. Basically, what we do, we just introduce the activity to the village government. The village government calls up for a public meeting. Then they ask for people who would like to volunteer. So there are normally people in the community who do the voluntary work. So those are the people then who volunteer to work with the project. Actually, we tell them for free, even if sometimes we give them some working tools. So they do volunteer, then we train them. Initially, we used to have like up to 4 to 5 per village. But as time goes now, we want to work with like up to 2, just in case the population is bigger, then we can add more. And we prefer having a male and a female so that we have a balance of gender. Yeah, because there is some information which some men will listen more to a fellow man. And there's some information at the household level where the women will really be conversant and happy to hear from a fellow woman. So that is how we work with what they do. They do a house-to-house education provision about the environmental cleanliness, about the health and the hygiene factors. And then they recruit people who are willing to become part of the program. Then we finally train those households which have agreed to become part of the program. And then those model households then become like a hub where other nearby households come to learn. So we wish to continue this modality because we have seen us getting some more outcomes by having people from the same community who volunteer to provide education to others. And that is the way we are able to get more and more education about the PHE to the entire community. Because those people are stationed in that community, they attend the community meetings, and in those community meetings, they provide the WASH information, but they also provide the other information which is not related to WASH, but which is your PHE.
Great, thank you so much. So we're going to go now to some of the questions that we have online. The first one from Dennis, he's asking, was open defecation a problem at the start of the project? And if so, how did the project deal with this issue?
Okay, yeah. So as I mentioned, the use of latrines there is a challenge, simply because in the beginning, people just used to defecate anywhere, just especially along the lake, because that is where most of the people spend most of the time coming to fetch water, coming to wash their clothes, coming to wash their dishes. Because of fishing, the population is actually situated at the lake most of the time, but because there are no toilets, the defecation used to be an issue. And we believe that is what used to cause a lot of diarrhea and cholera there. So as a project, when we started, then that's how we decided to have a component on the community. So we recruit the community health workers who provide the family plan information plus the WASH information. We also recruited the PHE champions who provide this house-to-house information on the importance of having toilets, on the importance of not just washing clothes just by the lake, on the importance of not defecating just anywhere. So it was through that process people became more and more aware. As people started constructing toilets, gradually that has reduced. The only challenge now is not all the households have toilets. So that is how that was attended, but we also connected with the health facilities in those areas. So the health officer from the health facility, they also provide information about hygiene and the importance of having toilets at home. Through the village meetings, also those things here are discussed. And for some few villages, there are some laws that are enforced for any person who defecate just anywhere, then they can be punished. But more and more we see through the education, then people are improving, then we see a behavior change towards defecation. And I should mention that before we started the project, cholera was an issue there. It's still an issue in Kigoma along the lake. But last year, 2017, there was cholera outbreak, but not in our villages of the project interventions.
Yeah, in addition to what Josaphat has just said, there are a number of behavioral change communication, like even putting some posters explaining the importance of not making open defecation. And among of the, it's like the guidelines, the bylaws of BMU, Beach Management Unit, include those ones, not washing dishes along the shore, not making open defecations. So all of these, they increase use of latrines and they reduce open defecation.
Thank you both for elaborating on that. That's really interesting and significant that there was no cholera in those project sites. Another related question asks, how many model households have been built and if there's a target established around this?
Thank you. Even though this is, I would not prefer to say target, but model households up to this moment, the program is having 2,351 model households. And maybe in this week, when we are finalizing our assessment, going to say this is a model household, there are steps to go through. And out of those steps, now, if it is qualified, as Josaphat explained some time ago in the slides, they have to have toilets, steel tap for washing hands. They have to have pens, maybe for animal, a good kitchen, and a number of dry rakes. So there are classes, but at least to qualify to be a model household, now we are having full registered 2,351 model households. In this week, of course, we are finalizing registration of 400 model households in Kompa village, which actually we expect to be the first model village as well. So the number will be increasing to 2,700 plus.
Wow, that's remarkable. Okay, so another question on the line asks about something mentioned in the beginning around inadequate access to primary and sexual reproductive health services in combination with a high population growth. So what has the project done on this subject in particular, and were there any findings after the first 4 years of the project?
Yeah, so the education and services around reproductive health has been part and parcel of the Tungane project since 2011. So part of what we have also done, as I mentioned, we have the community health workers. So these are the people who actually provide family planning education at the household level. So they move from one household to another, providing education about the family planning. They also provide education about the different family planning methods. They can offer short-term, some of the short-term methods like the pills and condoms. So for those who prefer other methods like the injectables, like the implants, like the IUCDs, they then refer those to the health facilities. And they also track whether the people they refer, whether they completed the referral. So we have a system which tracks that. We also provide that education to the young people around our villages. We also provide family planning and understanding the board education to the young people in the schools. So in terms of education provision, it has been there very well. So in the survey which you conducted in 2016 versus the one conducted in 2011, we have seen there has been significant increase in the knowledge of family planning and how family planning contributes to conserving the natural resources. That has gone higher. Also, the uptake of family planning methods has also gone higher. So that one, we have the data to substantiate. We, however, have a challenge on the desired family size. That one has not changed over the last 5 years, despite the education which has been provided. So much of what we now want to do is really to invest in more and more education for the youth and girls, because those are the people who can change the world, and those are the people who can change the perceptions about family planning, the thinking about family planning. So once they grasp this, we see maybe in the next years also the desired family size might drop.
What is the desired family size that you said hasn't changed? Could you just tell us?
Yes, understanding and knowledge and the linkages between family planning and conservation has gone higher, but the desired family size has not changed since 2011 to 2016. And we see is because of the nature of the respondents who were the head of the household who were interviewed, who was mainly the people of the age above 30-something, 40-something. And that's why we think the only way we can change this is to invest more and more education, but now targeting the youth. And we started in Tungane by focusing on the first-time parents, who are the young mothers, who are the girls below the age of 25, so that they started discussing about the spacing of pregnancy. And now we are moving towards including also their spouse. At the moment, we focus on the girls, the first-time mothers, but we still want to move further to engage in first-time mothers and first-time fathers, because we think those can be the people who, once they change the perception, then we believe in the future, issues around the desired family size will also be well understood, and we'll see a drop.
Wow, great, thank you. So we're kind of coming to the end of our time, and we have another 3 questions, so I'm going to ask them all at once. You guys. The first one is if you could speak a little bit more about the role of women in the success of the project. Another one is on investment, and if you were starting the project from zero, how many years would you need to reach a threshold of sustainability? 5 years, or would you ask donors to engage a bit longer? So that one was on investment. And then the other one that I previously saw, another one just popped up, but what is the perception around the household the model households in the communities?
Thanks. Maybe I would love to start with the first one. Yes, of course, behavioral change is such a difficult thing. It's like changing the direction of somebody walking. But me, with the way down, adoption of the knowledge and starting doing the practice, seeing the impact to this level within 5 years, from 11 to 15, I can see like 5 years to come with the serious interventions. Maybe we can speak a serious, sustainable level of program going, even without our presence. So I would love to say 5 years, I can see the program can go there. Oh yes, Lukindo was speaking. And then, even though Mshighati, maybe I think would like to chip in, but I would say there is a very high importance of women as a successful factor in this project, to be seriously involved. We have been involved in them, but I can see. And if I'm speaking on women, you see, like when we are doing like livelihood support in things like Kokoba, women are the majority, and you see how the project can be much accepted and change be taken easily. And down here in Tanzania, especially going to Tungani area, women are having enough time staying with the children and the families. So they have enough time to educate the family as well. So when we are speaking the role of women in this program, I can say it's very high. The role of women as a successful factor. Mshighati will chip it. Leaders, whatever we are doing in order to attain sustainability in the program, we are connecting them with the leadership. The beach management unit, we said, they are having some important relationship to community leadership or local government leadership. The model household and champion, the way they are reporting, they are connected to village leadership. So it's like we are investing a lot. We are investing in community leadership to ensure they are making their own leader on transformation, on change. And they involved almost in every step we are doing in terms of implementation and the adoption of the new approaches. Back to Mshighati for some additions.
Just a very quick one, because time is not on our side. We involve a lot community leadership in the program, but specifically on addressing desired family size, maybe we need to do more and more. What we normally do is we train the village leadership on issues around the PHE. And then we include also the family planning discussion during the PHE for them to see the relationship between the number of children and resource management for today and tomorrow. They provide now space for us for our community health workers during community meetings to provide education about family planning and PHE. So that's the only way we work with them at the moment, for them to understand these dynamics and for them to provide more space for the project people to talk more and more about this to the community members. But probably we need to do more. We need maybe to invest more as to how we can really be able to change their mindset so that they become spokesperson of family planning in their meetings. Back to the issue around involvement of women, just the last point I want to speak is really the women who go to fetch water in our context, the women who walk long distances, the women who have to go to the hospital to take their children or any family members if they are sick, for example, they have a diarrhea, is the women who suffer when the environment is not clean. So we have been working more and more with the women, but just saying as household, but we need to do more and more with the women in terms of economic empowerment for the women, so that they're able to contribute significantly to the income of the family, of the household, and then they have a voice where they can say, we are prioritizing a toilet now. In their absence, where they don't have voice because of their income, then we may not see a lot changes happening But once we're able to empower them economically, then I believe they'll have more voice at the household. They will have more voice in terms of resource allocation, so that they allocate resources to issues around wash, because it affects them more and more.
Excellent. If time allowed, I would ask you more questions about that, but we did have one more question on the line. So if you guys don't mind hanging on with us a couple minutes more. Somebody asked about lessons learned from this project, and if you could have done things differently from the start, what would it be? Would it be around the design, the theory of change models, or actual implementation?
I think if we are starting now, because you have to acknowledge we started the project bit by bit. So some components came in a little bit later, some others started earlier. So like the concept and the practice of model household came a little bit earlier, while other things started a little bit earlier. So the one of the best way could be starting a program where we are sure that everything filters down to the model household, and then have all the other interventions of Tuungane targeting the people who are in the model household, so that they are able to be part and parcel of all the activities. In that way, we'll have been able to get more outcomes than the way we are now. But also, I think what I would have proposed to change if we were to start afresh was actually agreeing with the local government from day one on the scale up methodology for the project. For example, if we start in few villages, how can the government also put some money for other villages so that we complement each other? So that is what I would propose if we were to start afresh from now.
Yeah. In addition to that one, for example, the approach now we are taking in Nkonkwa village in addressing model household, the government, local government leaders like hamlet leaders, they are part of the champion. So we are bringing more and more into center the community leadership.
Great. That's excellent. Thank you both so much for giving us this wonderful presentation. It's really encouraging, and hopefully we're as joyful as the people in this picture at the end about all your results, and we'll look forward to hearing more in the future. I just want to give a shout out that this recording will be placed on our Community of Practice LinkedIn site, which is part of the Africa Biodiversity Collaborative Group Freshwater Wash Task. So if anyone on the line has not signed up for that, please do. And we also have our last end of task presentation tomorrow morning at 9 o'clock here at CI. If anyone wants to come over, we'll have breakfast and coffee. And we'll look forward to hearing from Colleen Sorto from CI and Peter Appel from Jane Goodall Institute. So thank you guys very much for your participation and for staying late in your offices over there. And we really appreciate everyone's participation. Thank you so much.
We thank you so much for the opportunity. Thanks a lot.
And thanks a lot. You got up early in the West Coast.
Asante sana.
Asante sana. Thank you.